Hey guys, Carrie here. Welcome to my Tray 2122 update. The reason why I'm calling this Tray 2122 is because I'm actually skipping Tray 21 on top altogether because the orthodontic assistant cut off my wisdom teeth on the top instead of the bottom like she was supposed to. So I decided I would just wear Tray 22 for 2 weeks. I took the trays out right now and I've had a lot of pain. I changed Tuesday night to Saturday. I had a ton of pain right on this first bicuspid right here. I think they're trying to make it, instead of flaring out like this, they're trying to contort the root to go up like that. And I don't know, but it's been really, really painful, almost like regular braces. It's just been pretty bad. Um, Also, recently, I started using retainer bright to clean my trays instead of peroxide all the time because the peroxide all the time started to make them really, really foamy toward the end. And I don't know that it's really that good for me to keep putting that much peroxide in my mouth. Um, but the retainer brights get them super bright, and I got it on eBay for not that much money. So that was pretty cool. I still want to use the peroxide once a week though, because if I don't use the peroxide at all, my gums really started to fall apart. I went to my regular dentist for a cleaning on last week, and when I was there, the um, hygienist was like, "Oh my gosh, you've got some really bad pocketing starting and all this," and my gums were bleeding so bad down here. And you know what though? I cleaned the trays then with peroxide like 2 days later, and all the bleeding stopped in here. But when she was trying to use the little tool and stuff, it hurt so bad. And she's like, "You don't have hardly any plaque or tartar," and I'm like, "What are you doing? This hurts." So that was that. I know from teeth shifting they can create natural pocketing, and I'm assuming that's mostly what was going on. But my gums have really fallen apart a lot with this Invisalign. It hasn't been fun for me. I've had that emergency. I've had like two other times where I've had serious gum inflammation from, well, I think it's from Invisalign. I don't think the manufacturer will ever admit that. But so yeah, I'll show you where I'm at now. And I am still wearing the elastics at night. The other thing I wanted to point out is the reason why I'm skipping tray 21 is because they cut off the wisdom teeth on the back of the upper. I'm still on tray 21 on the bottom though. This was the first Invisalign tray. Oh, wrong row. Ah, okay, I'm a moron. Let me fix that. This is the first Invisalign tray I had, and then the one on the outside here is the new tray that I just put in this, well, last week. So I'm going to actually wear it a second week on tray 22. But you can see on this side particularly, this wisdom tooth has a lot has come back in versus where it was when it started. That's why when the assistant messed up and just cut the wisdom tooth off of tray 21, I just thought, I didn't want to like have it move back in any way and then have to move back again. I thought that would be too painful later. So I just figured, no need. So that's where I am now. The trays come in and out real easily. I've had an increased amount of pain like 4 days later this time over here. Still kind of upset because anytime I want to go out to eat, it's this major project, and I almost don't even want to eat out at all anymore because it's just you got to bring your toothbrush with you. It's like such a lifestyle change. So many people don't realize this whole Invisalign thing is. Let me give you a close up like my tail. Yeah, I'll put these back in. Huh. Yeah, I don't think that's the right tray. Ah, yeah, it is. No, it's not. That's pretty bad. Yeah, I've just got these trays sitting out here, and I'm kind of like, which one is it? And then it doesn't even fit. Like, that's an upper tray. I don't even, here it is. The reason I got confused, too, is because she didn't even cut off the whole back part of that one wisdom tooth. So this is how it looks with the trays in. As far as the jaw goes, too, it's not especially happy with Invisalign overall. I just have to say that. I don't know that this is the primary way you want to treat a TMJ patient. I really don't think so, but that's just my 2 cents. Thank you guys so much for watching, following along, especially my 35th month in reversing previous orthodontic work. Have a great night. Aloha.